What's up, everybody? Hey, Facebook. Welcome to the party. Hey, I'm excited today. Got a chance to sit down and chat with anybody out there about one of the things that I love the most about dentistry. That's implants. Particularly replacing all of your teeth with implants. And I love this because it makes such a dramatic difference for the patients that undergo this type of treatment. It can replace all your teeth, give you that smile back, the confidence back. You know, if you've got badly worn down teeth or lots of decay or gum disease or have lost teeth for a number of reasons and you're looking to replace those teeth, then what we call full arch implant solutions might be the right solution for you. When we're talking about full arch, what we're talking about is replacing all the teeth on the top, that's one arch, and all the teeth on the bottom, that's an arch. So we all have two arches of teeth in our mouth. And implants have come a long way over the years. They're super predictable and have really, really changed the lives of lots of people now. Millions and millions. They are for people pretty much of all ages. Once you've finished growing, made it through puberty, early 20s, mid-20s, all the way up to 80, 90 years old. You know, there's no age limit for implants other than being too young. We don't want to do implants until you're finished growing. But typically the folks that are still growing are not in the types of scenarios that we're talking about today, which is replacing all of your top teeth or all of your bottom teeth with implants. So let's dive right in. There's a couple major categories that we'll talk about here, and that is, first of all, it's called fixed hybrids, also known as all-on-4 or all-on-X. What the heck does that mean? That means replacing all of your teeth on a number of implants. If it's all-on-4, then we're talking about 4 implants. That is something that has become totally popular, using 4 implants, and it's awesome in lots of instances. But now what we really like to talk about instead of all on 4 is we talk about all on X. And what that can mean is all on 5, all on 6, all on 7, all on 8. And so we like to call it all on X. And most clinicians would prefer to place as many implants as possible as opposed to just 4. 4 implants are awesome because oftentimes the patients that are seeking out this type of treatment don't have the bone that allows us to place more. And so basically 4 is the bare minimum to give the type of treatment that these patients are looking for to be able to achieve those goals of having a full set of teeth that allow you to smile, laugh, sing, talk, and eat whatever you want instead of what you can. So the all-on-X implant treatments are awesome because those are teeth that don't come in and out. They stay screwed in. We used to say they need to be taken out once a year for cleaning by your dentist and then replaced. But now, new protocol is we don't take them out unless there's an issue. And seldomly are there issues. We'll talk about things that could lead to issues with the all-on-X treatment. But let's talk more about what all-on-X treatment is. All-on-X is totally awesome because now it's become so predictable using 3D x-rays like I've got back here and three-dimensional digital planning software. If you have the right know-how, you can plan the whole surgery ahead of time on a computer instead of winging it on the fly in live surgery. So we'll look at this 3D stuff. We'll plan where we want all your implants. And then we can even 3D print surgical guides that snap into your mouth and make sure that the implants are delivered with digital precision, exactly where I planned them to go back here on the computer. So that's totally cool. It brings another level of efficiency, time savings for the patient. Obviously, we want to get the surgery done as fast as possible. It leads to a better recovery for you, the patient. And it also leads to greater outcomes. We can achieve more by having it planned ahead of time. Really, the biggest advancement since the digital treatment planning and 3D printing came in, is in materials. And there's a wide array of materials that can be used for All-in-X, basically from converting dentures all the way up to 3D printed stuff to using printed titanium substructures, really hard, really beautiful ceramic materials that give both aesthetics, function, and lack of bulk. Materials that allow us to take one fake tooth out at a time. Let's say you fell walking your dog and chipped a tooth. We can remove that one tooth off your implants and have a new one made in a week or in a day, maybe even in an hour, depending on the situation, and replace the one broken tooth as opposed to replacing the whole prosthetic arch, which is what we used to do in the olden days. When I talk about olden days, I'm talking about 2, 3, 4, 5 years ago, because technology is really advancing at the speed of light in this area of dentistry. So we can also talk about acrylics. The cool thing about acrylics, although they're more bulky and less durable, they allow you to get screwed in teeth at a lower price point. So let's talk numbers, like the best of the best, the absolute Cadillac, Lexus, and BMW, going to sleep, having all your teeth taken out, having all your implants put in, waking up with a brand new smile screwed in that leads to the very best of the best, you're looking at like $30,000-ish, okay? Now, that doesn't fit into your lifestyle, then we can talk about other options. You can still have a really nice, beautiful, durable smile that gets screwed in while you're asleep for much less money. Maybe call it $22,500. That's still really pretty, really durable ceramics. Look, fit, and feel awesome. The difference between the $22,500 and the $30,000 would be that the $22,500, if you did fall and break a tooth on your prosthetic, then we would remove the entire set of teeth and send them to the lab to be fixed. Now, that's not something that happens often, but if it did happen, you'd be dealing with not having your teeth screwed in there for maybe up to a week while the repairs are made. Of course, we'd have a backup plan for you, but it wouldn't be a screwed in backup plan. The $30,000 option, I'd make a tooth right here in the office for you. You would come in with a broken tooth and you'd leave the office with a fixed tooth. Everything would stay in your mouth, look, fit, and feel awesome. So that's the give and take between the $30,000 and the $22,500. $22,500 still too much for you. I get it. Everybody's got a budget. Something that we've come up with here in our office that I'm super stoked about is a long-term temporary. And our long-term temporaries, we brought technology to Shreveport that hadn't made it here yet. In fact, I've been training lab techs in the area how to deliver this to patients using materials that create long-term temporaries that look, fit, and feel awesome. How long will a long-term temporary last? Can last, 2-3 years. I don't like to make any guarantees on those, but I can tell you that they're lasting much, much longer than anything that we've been able to do before. Typically in the past, we'd make temporaries that would last about 6 months while your bone was healing and everything was getting set up rock solid and ready for us to go into the finals. Now with this long-term temporary material, really the sky's the limit. We're not sure exactly how long these can last, but we've seen them last, around 2 years. What do I mean when I say they don't last? Well, it is made from a reinforced acrylic material. And what happens with that acrylic that's been reinforced is the finish wears off. It is a more porous material, so it doesn't stay super smooth like the final material would. And what that leads to is it could lead to staining. The other issue with these long-term temps is that they're a little bit more bulky than the final. So what you get with the long-term temp is you get the ability to go ahead and have a smile, confidence, the ability to eat what you want, to be able to smile. You know, if you've been feel like you've been held back in your career or held back with relationships or family or romantically or friends, you know, you get that. And you get all that back. You'll look great. Your confidence will be restored. You'll have the ability to go, you know, try to get the promotions or the new jobs or the new relationships or reach out to friends and family. They'll be super impressed with your smile. It'll look beautiful. It'll be totally functional. It's just not going to last forever. You have the ability to save up your money, and when you're financially able to make that leap into the finals, then you can do that. So where I've told you that the finals are $22,500 or $30,000 depending on the option that you choose, you can go into that long-term temporary for like $12,500, save up your money, and then make the upgrade later when you're ready to. So the long-term temporaries have been something that we are really excited to offer because it allows you, the patient, to go ahead and get what you've always wanted, to go ahead and get the ball rolling. You don't have to kick the can and continue to suffer with pain or infections or bad breath or feeling like you don't have the confidence to go out and achieve everything that you want to achieve in life. You go ahead and get those teeth, go ahead and get the ball rolling, and you have time to save up money without having to wait. So it's a really great option. You go ahead and get your teeth, you don't have to wait, and you start saving money towards your finals. And like I said, we've seen these long-term temporaries last as long as 2 years. So an awesome option that we're excited to offer. Some patients, $12,500 is too much, $22,500 is too much, $30,000 is too much. They're never going to make that a reality, and we get that too. So look, there's options. If you're one of those people, there's options for that also. You know, then we need to start talking about teeth that don't stay in, but are still given so many of the luxuries that implants offer. So we can make teeth that snap in and snap out using implants. And what that allows you to do is to, like I said, go ahead and have missing, broken, painful, infected teeth removed and implants put in and get a whole new smile. You know, you can look online, look at our social media and see what these snap-in teeth look like. They look great. They do come in and out. Whereas I would say the fixed hybrids or the all-in-X's that I started this conversation talking about, the teeth that are screwed in that don't come in and out, I'd say those get you to like 85-90% of what God gave you. You know, when your teeth were perfect, when you were 18, you know, we'll get you 90% of the way there. The snapped-in dentures, the removable teeth, I'd say they get you like 50% of the way there. They're great. They look awesome. What you're giving up is you're giving up bulk. They are definitely more bulky than the screwed-in options, and they definitely don't have the same functionality as the screwed-in options. You know, I have patients with snapped-in teeth. They love them, but they come to me and they tell me things like, hey, if I take a pencil and I try to chomp down on a pencil with my two front teeth, then the backs of my implant, my removable teeth, they pop up. Yeah, that's going to happen. Snap-in dentures are not meant to give you 100% function. They just can't do it. They can give you 50 or 60% function. Well, what is 50 or 60% function? That means you're not using goo and paste to hold your teeth in. That means you can chew things that have substance to them. You know, I know a lot of our traditional denture wearers tell me the things that they miss the most is having the ability to chew meat. You know, whether that's pot roast or chicken, grilled chicken, or pork chops, or whatever you love to eat, you know. A denture with goo and paste, it's not going to give you that ability to eat those things. The snapped-in dentures will. Once again, I like to set expectations properly. It really creates a great relationship between me and my patients. I'm going to tell you what you can expect. I'm not going to sugarcoat it, and I'm not going to lie to you and then have you unhappy with the final product. You know, I like to build that trust in with my patients. Snapped-in teeth are way, way better than teeth without implants. In fact, I believe a denture without implants is below the standard of care now. in 2021. I believe everybody with a denture should have at least 2 implants. They make that denture so much better. The retention and stability is at least twice as good as the denture without implants. Okay? So if we say screwed in teeth that don't come in and out give you 90% function, and a snap-in denture gets you 50-60% function, hey, the reality, a denture without implants, 15, 20, maybe 25% function. Honestly, a lower denture is more for looks than anything else if you don't have implants. Okay? 99% of folks with lower dentures without implants will tell you they're awful. They're awful. They haven't changed much since George Washington had his denture. I think his was carved out of wood, and now ours are made out of acrylic. But they really haven't come much further once we converted from wood to acrylic. They still are not comfortable. They still give you sore spots. They still require goo and paste. Everybody's seen Fix-A-Dent commercials on TV and heard them on the radio. That's because you will not find a denture wearer who can wear their dentures without goo and paste on the bottom. That's the reality. Implants allow you to get away from the goo and the paste. So it is a major upgrade for somebody that has had a denture without implants. Don't get me wrong. It is a major upgrade. The things you'll be able to eat will dramatically improve. The quality of your life will dramatically improve. You will have the confidence to laugh and not worry about your teeth popping out. The confidence to talk and not worry about your teeth popping out. You're not going to be able to, like I said, bite down on pencils or, put them to the test. But the fit, feel, and functionality of a snap-in denture is easily twice as nice as a denture without them. Okay? So just to put things in perspective, that's about an $8,500 investment in our office. All of our full arch treatment plans, whether it's $30,000, $20,000, $8,000, they're all inclusive. We stand behind our work. Talking about sedation. If you're healthy enough for me to do the sedation, and I do about 90% of my own sedations here, that covers your sedation. That covers the rapid recovery package. We have an awesome state-of-the-art rapid recovery package. In fact, I came up with that term, the rapid recovery. And let me tell you a little bit about that because it's something that has really, really helped our patients that I'm super proud of. Our rapid recovery starts with an all-natural gel and rinse that you start to use 3 days prior to surgery. This prepares your gums in your mouth for the surgery. It lowers the inflammation in your mouth because obviously if you're undergoing these types of procedures, you've got germs, infections, gum disease, cavities. Things are going on in there that aren't awesome. Otherwise, you wouldn't need this type of procedure. This helps to reduce all that inflammation and prepare your mouth for surgery. It's kind of like thinking about scrubbing in for surgery. You kill all the germs. The doctor kills all the germs on their hand before they go into surgery. This proprietary gel and rinse removes germs, removes inflammation before surgery. Okay, then we put you on steroids. Unless you're diabetic, we start all of our major surgical patients on steroids 2 days prior. What steroids do is they are very, very strong medications that reduce inflammation. Pain comes from inflammation. Inflammation is what causes pain. So if we can start to reduce the inflammation in your body before I've even touched you, we're way ahead of the game. Then day of surgery, we draw some blood. We have a very fancy high-tech protocol where we spin that blood in centrifuges, and we create something called platelet-rich fibrin, PRF. What is PRF? That is your body's own healing and growth factors. We take out of your own body the things that help you heal. We concentrate that, and then we put that back in the surgical site. This has changed the game. What this does is dramatically decreases healing time. It accelerates healing time at a phenomenal pace. It decreases the likelihood of infections, and it decreases inflammation. Of course, any kind of surgery, whether you're talking about an ingrown toenail, a hip replacement, or dental implants, you want to decrease infection, decrease pain, and decrease healing time. The other thing during our sedations, we have an IV. We have IV access, so we're going to give you long-lasting pain medications in your IV and more steroids, okay? And then we follow up afterwards with an awesome narcotic cocktail that we have using the best narcotics. And we continue with the steroids for another 3 days, and we continue with the all-natural rinse and gel. And I can't tell you why. I don't know why, to be completely honest with you. But all of my big surgery patients and all of my small surgery patients, whether they have dry sockets or other issues that create pain after small or big surgeries, they tell me this all-natural stuff is the ticket. They love it. All of our surgical patients tell us this all-natural stuff was way better than the pain pills, which is what we love hearing, because everybody's trying to find solutions to combat the opioid crisis. I watched a film on YouTube this week about a beautiful young female gymnast. She was headed to the Olympics. She was in the Olympic training program. As you can imagine, spraining knees, spraining ankles, tearing rotator cuffs as a competitive gymnast. She started going to pain management in her early teens, 16, 17 years old. They start prescribing pain pills to her. You know, fast forward, she's 28 years old now. She's on YouTube because she lives on the streets, and she's addicted to fentanyl. Now, look, that hasn't happened to any of my patients, but it happens every day to good people because they needed pain pills for surgical procedures or for pain. You know, anything I can do as a clinician to help offer my patients solutions without narcotics, you better believe I'm going to be on board for that. I'm telling you this because all my surgery patients tell me that this non-narcotic, all-natural pain reliever works better than the narcotics. It just does. So that's part of our rapid recovery package. That's all included. You know, like I said, everything is all-inclusive. No matter how many teeth you need taken out, whether that's 1 or 32. We don't charge you per tooth. We don't charge you based on the amount of bone grafting that you need. We don't charge you on the amount of sedation medications that you need. We don't charge you based on the time of the procedure. Whether it's a 1 hour or 4 hour procedure, it's all one fee. It's one investment. Any complications that could arise, no more investments on your part. I take care of you. Okay? It's like an all-inclusive vacation. You go on vacation, you don't have to worry about nickel and diming. If you want seconds, you go back, you get seconds. You want more to drink, you do that. You want to get in the pool, you do that. It doesn't cost you an extra dime. Same thing with our full arch replacements. It's all inclusive. So just to break it down, you have teeth that are screwed in. You have different materials to fit different budgets. And then if you can't afford that, if that's not a reality in your lifestyle, we get it. Then you have implant retained dentures, snap-in dentures. If that's not something that fits in your life, then we have dentures under that. Like I said, I truly believe that the standard of care now is not a denture. The least, the lowest point of entry should be a denture with at least 2 implants, and after that we can upgrade. But believe me, a denture without implants will never make you happy. So consider that. Ken is replying, sedation's the way to go, takes the anxiety away. You're right on, Ken, and thanks for all your help. Ken's on our sedation team. He's in the room with 90% of our sedations. He sees what we do. He's an awesome part of the team. Couldn't do it without you, Ken. Thanks, bro. What Ken doesn't see is he doesn't see the post-ops with the patients coming back to me having no recollection of what happened. And that means the world to me. It means the world to our surgical patients, you know. Dentistry has come a long, long way. And if I was a patient, I wouldn't want to be wide awake for some of the things that I'm doing. And I definitely wouldn't want to remember. I'm super, super happy that we can give that to patients, you know. I just took out a single tooth on Monday. I guess that was Wednesday, wasn't it, Ken? I took out a single tooth on Wednesday, and it was a bear. It was not fun for me. Fortunately, the patient was in la-la land. The patient was snoring, Ken can give me a thumbs up if he remembers that patient snoring. The patient was snoring. Called to check on the patient, talked to his loved ones. He had no clue what happened. He didn't remember it. You know, that kind of stuff. I've cut a short video for social media after that happened. You know, it's humbling to me, and I'm super glad I can. Yep, there's Ken with the thumbs up. He remembers that patient snoring. I'm super humbled and happy that I can give that to patients because, you know, 98% of dentists can't, and I'd hate to think about having that done to me wide awake. Whether you're numb or not, that's not something you want to be fully awake for. That's not something you want to remember. So sedation is definitely the way to go. Thumbs up are still coming in. If anybody has any questions, fire away. This is for you to learn more. I think we've pretty much covered our bases without making you dizzy, going over too many options. I try not to go too deep unless you ask for more depth. I can go as deep as you want, but I try to keep it at a digestible level for y'all. We are offering consultations. I'm trying to do these consultations for folks that are interested in big rehabs and possibly replacing all your teeth. I'm trying to do those on Fridays. We can sit down, review all your 3D x-rays, talk about all your options, your particular health concerns, you know, whether you're a smoker, a diabetic, you got Crohn's disease, you know, whatever it is, cancer treatment, you know, we stay on top of the research. We can answer all your questions. I can answer 99.8% of your questions, and if I can't answer them, I know the people that can. So if you want to talk, reach out to us, social media, online, phone, email. It's real easy to find us. We're even here on Fridays. Facebook Live today on a Friday. I'm at the office. Reach out to us. We'll get you scheduled. Set aside some time for the two of us to talk. Bring in your loved ones. Loved ones are super important to have at these consultations because oftentimes the patients, you know, they get overwhelmed, and it's good to have a second set of eyes and ears there to help remember everything that we've talked about and come up with other questions. So bring those loved ones in. We love to meet them. We love to hear your story, why you're embarrassed, why you've lost confidence, the foods that you can't eat, the promotions you feel like you haven't gotten, the relationships you feel like you hadn't been able to go deeper into, the way you've drawn back from friends, family, and loved ones, the way you've drawn back at work. We love to hear that. We love to be the pathfinders to help guide you on the journey that you want to go down. You know, we like to help show you solutions that fit into your lifestyle. So, Digital Doc, thanks for the thumbs up. Everybody enjoy your weekend. Y'all hit us up. There's way too easy to find us. Find us if you have questions. I'd love to spend time with you. Y'all have a great day. Thanks for your time.